Okay, hello, good evening. Assalamu alaikum. Today we will start just a brief summary about acid-base disturbance and how to read ABG. Very common question in the exam, part A and part B. Part A, you have maybe 15 questions about ABG by different ways, asking you about the pH, asking you about the acid-base disturbance, asking you about the complication or the condition, or asking you about the any parameters of the ABG. By different ways, you can expect the patient, even sometimes he can give you a problem like pulmonary embolism and just give you the ABG just to go for what is the treatment. So by indirect way, he wants you to diagnose this is okay, this is respiratory alkalosis, so this is maybe pulmonary embolism. So you go for what is the medication, whatever the medication you will go for. Okay. Any interactive, someone can just answer me so we can continue. Okay. Who can open the mic and be with me just to be interactive with me? Dr. Ahmed, Dr. Amina, Dr. Aya, Dr. Dalia, Dr. Catherine, Dr. Muhammad, Dr. Iskandar, Alexander, Dr. Sambul, and Dr. Aya again. Okay. Okay. Let's start about ABG or acid-base disturbance. What is the normal values of ABG? Normal values of ABG is like you can see now, and you have two parameters, and you should know both of them. Okay. Anyone can open the mic?
Yes.
Okay, Alexander.
Yes.
Thank you.
Sir.
Dr. Amina, yes, thank you.
Sir.
Okay, Dr. Muhammad, I want you all to be active with me, please. Even in our recalls course, we solve all the question of the last 5 years or 4 years, all the exams, about more than 15 exams. We like to solve it in interactive way. So you will not remember, you will not forget anything you answered wrong or you answered by your mind with me. Okay. Starting with ABG, you have to know the normal values. Very important, the normal values. What you'll see, you have two values. You may need it in part A or part B more if you have to know every parameter by millimeter mercury, and ABG will be fixed by this way. Okay. This will be fixed by this way, and change will be in the PO, CO2 pressure and O2 pressure. And sometimes he gave you this by millimeter mercury, and sometimes give it to you by kilopascal. The most common in exams till now and all the exams before, the kilopascal. And in the exam, he gave you table about everything. So he gave you the normal value and then give you the finding. Okay, so he gave you that pH normal from 7.35 to 7.45, and what we found that 7.21 as example. Okay, this is a start about the question of the ABG. What is ABG? ABG is the pH of the blood. pH of the blood is the amount of hydrogen hydrogen ion in the blood. Hydrogen ion is the acidic parameter. That means that you more hydrogen ions you'll find in the blood, the more acidity will be the blood, and vice versa. The less hydrogen ions in the blood, the less acidity of the blood, or the more alkalinity of the blood. Okay. So if you have more H, this is normal value from 7.35 to 7.45. If we go to 7.5, this is alkalotic condition. If you go to 7.3, so this is acidotic condition. So I have more hydrogen here, and I have less hydrogen here. Here is more hydrogen, here is less hydrogen here. This is the first parameter you have to know. The second parameter is important, is the CO2. CO2 normal from 4 to 6. Sometimes you find it 4.6 to 6. Sometimes whatever in the exam, he will write to use the normal parameter. This is the normal one. So if you found it 7, so you have more CO2. CO2 is the respiratory parameter. HCO3 is the metabolic parameter. As we know, ABG, or the blood ABG, or acid-base condition, or depend on two parameters. One respiratory and one metabolic. Both of them act together to make the pH of the blood within 7.35 to 7.45. Both of them work together. What is responsible for the respiratory parameter is the CO2 pressure. CO2 pressure response. So if I have more CO2, so I have a condition of acidosis, which is respiratory acidosis. If I have less CO2, so I have a metabolic, I have alkalotic condition, which is respiratory alkalosis. So CO2 give me condition about this is acidosis or alkalosis, but this is according to a respiratory cause. The other one is the metabolic. Metabolic depend on the metabolic condition, or the metabolic parameter depend on bicarb. Okay, HCO3 is a metabolic. What can we see in this? If I have more HCO3, so I have more alkalosis, but it will be metabolic alkalosis. If the body lost HCO3, so I have less HCO3, so I have an acidotic condition caused by metabolic cause. Clear this point?
Yes, clear.
Yes.
Clear for all? Clear. Okay, so I have respiratory and I have metabolic. What is done by the body in any case, that if I have a respiratory acidosis, the metabolic condition try to go direct or to direct the blood condition to the metabolic way, so trying to correct the acidosis and vice versa. Any one of these go in one direction, the other one trying to pull it to the other direction. And this is God's God's thing in our body, one of the goodness of God. So in our body, we have something to repair any problems that happen in our body. The other thing about, I want you to know, just to know that if I have a metabolic, put this in your mind, very important. If I have a metabolic condition, respiratory compensation, can happen within minutes. So if the body got into metabolic acidosis, so respiration increase to make the body lose CO2, so trying to go to the alkalotic way, so trying to repair the acidotic problem. If the blood is metabolic alkalosis, so respiration will decrease, so increase the CO2, so increase the acidity of the blood, trying to repair the alkalotic condition. On the reverse, if I have a respiratory problem, whatever respiratory alkalosis or respiratory acidosis, the metabolic compensation takes from 24 to 48 hours to compensate. Okay, if I have a respiratory problem, whatever respiratory alkalosis due to hyperventilation or respiratory acidosis due to respiratory depression, if this acute, put acute in your mind, if this acute condition, you will find the metabolic parameter or so metabolic parameter is within normal, because it takes from 1 to 2 days. By the way, the metabolic condition regulated by the kidney and the respiratory condition regulated by the lungs. The lungs works fast in case of metabolic condition, but the kidney works so slowly in a case of any respiratory condition. So if I have a respiratory condition, the kidney to start to compensate, it takes about 24 hours till 48 hours. So who can answer me in this question? If I find a respiratory problem, maybe respiratory acidosis, and I found the HCO3 within normal, what you expect the condition to be? Maybe COPD or respiratory depression by opioids مثلا. What you expect to find if this is normal?
Sir, it may be respiratory depression by opiates.
Okay, why?
because in COPD there is respiratory COPD in COPD there is bicarbonate is increase.
Any chronic. We will see this in question now. Any chronic respiratory problem, the HCO3 will be high.
High. Yes, sir.
So if I go with the choices and I found COPD, atelectasis, infection, opioid action, whatever, and I found HCO3 high, I go direct for the chronic condition. But if I found the HCO3 normal and give me in options anything like respiratory failure type 1, respiratory failure type 2, respiratory failures, and give me COPD, then give me emphysema, give me IPF, whatever. All these chronic conditions can't go with normal HCO3. Okay.
Sorry, sir. Once again, please.
Once again. Patient with COPD or emphysema or interstitial pulmonary fibrosis. Okay. And another patient has opioid depression of respiratory center or has acute respiratory failure, or patient has pneumothorax, patient has flail chest. And in both cases, you will find the patient has a respiratory acidosis. Yes?
Yes, sir.
Okay. In this patient has a, what is the difference between this and this? HCO3. Here will be within normal. There is no time here, about 1 to 2 days to start to be raised to compensate. So this problem, mostly you'll find the HCO3 normal, but in this condition, HCO3 will be very high. This is a chronic condition. And you'll find here respiratory acidosis uncompensated because the HCO3 was a normal. Here you'll find compensated respiratory acidosis. Okay?
Okay, sir.
Clear this point?
Yes, sir.
Clear.
Yes.
Okay. So
Yeah.
what you have to know from this page, you have to know this. By any way, in part B, they will not give you a normal parameter. Normal pH, you have to know this parameter. Normal CO2, you have to know this. Normal HCO3, you have to know this. And this will be in a table in the exam till now. Okay. O2, you have to know from 10 to 13, from 10 to 13. This is very important also to know to determine the O2 will help you in case of respiratory acidosis. To know, is it respiratory failure type 1 or type 2? So The O2, you will just need to determine the type of respiratory failure. Clear? What is the difference between type 1 and type 2?
Type 1 is hypoxia and type 2 is hypercapnia with hypoxia.
Hypoxia and
Okay.
hypocapnia.
Okay. So O2 is important to know this. How to know this? Type 1, for easy remember, type 1 has only one problem, hypoxia. Type 2 has two problems, hypoxia, hypercapnia. Okay? Clear?
Yes, sir.
Yeah.
Okay. Okay. Let's go for this picture as we discussed. This is the normal pH from 7.35 till 7.45. As we go up here, we'll go for alkalosis. As we go down here, go for acidosis. CO2, forget about it, keep it from 4 to 6. Okay, keep it as we said from 4 to 6. As we go more, sorry, we can make it okay, this is the 6, yes, and this is 4 or 4.5, whatever. As we have more CO2, we have go acidosis. Who has less CO2 will go for alkalosis. The bicarb go to the other side. If we have 22, less than 22, will go for acidosis. We have more than 26, we go for alkalosis. Again, as we said, CO2 acidosis, CO2 less alkalosis. Who's responsible for the respiratory is the lung. The metabolic condition is responsible, kidney is responsible for it. As we have more HCO3, we have alkalosis. We have less HCO3, we'll have acidosis. This is some causes of acidosis, metabolic acidosis, metabolic alkalosis, and what will happen, and some causes. And not asking about the causes many in the exam, but he asking about the equation itself. And this is respiratory acidosis, and this is respiratory alkalosis, and this is the condition that can happen in everyone. Okay, let's go for some examples here. Sorry?
Sir, one question. When we can say that it is compensated, or it is compensated by renal compensated or respiratory compensated,
Okay.
when we can?
When we can say this compensated or not compensated. Okay, compensated means normal pH. Okay. We have compensation. Okay, nice question. Okay, we forget to explain. We have what is called partial or fully compensated. Okay, we said normal pH is from 7.435 till 7.45. If I have a metabolic problem and I have metabolic problem, and I have HCO3 high. So I have a metabolic alkalosis. Okay, so I expect to have the pH is 7.48. Clear? pH is 7.4 clear. If I go for the CO2 and I found it normal, CO2 normal, so this is uncompensated metabolic alkalosis or uncompensated condition. This is not within the normal range, and at the same time I have no change on the other parameter. I have no change on the other parameter type. If I find the CO2 is high, but still I have the pH 7.48. What I expect? I expect that the pH was 7.5, and when the CO2 started to go to the acidic condition, started to pull the pH towards the acidotic case or to the normal range, and started to be this. So here I can go say partially compensated metabolic alkalosis type. If I found CO2 is high, but I found this pH not, I found it 7.44. This is normal or not normal?
Not
You want
normal.
answer? 7.44 normal or not?
Normal.
7.4 is normal.
Normal. And I went for the CO2 and I found the CO2 high. And I know this the condition is due to HCO3 high. Okay, so I have mostly towards the alkalotic. It is here, almost here, 7.44, just before the end. So this is mostly to the alkalotic. So I have an alkalotic condition. And I found the CO2 high. So this is what we call fully compensated metabolic alkalosis. Fully compensated metabolic alkalosis. As I have the HCO3 high, okay, and so this is alkalotic condition, and then I found the CO2 start to be high, just to compensate for the alkalosis. So I can say this is fully compensated metabolic alkalosis. I have another thing. If I found pH is 7.48 and I found HCO3 28 and I found CO2 3.5. What do you expect here? What is this pH?
pH is high.
Alkalotic. Let's talk today normal, alkalotic, acidotic. Okay, pH is
Alkalotic.
HCO3 is
Metabolic.
okay, this is metabolic. Alkalotic or acidotic?
Alkalotic.
Alkalotic.
Because normal from 22 to 26.
26. Yes.
Okay, so I have 28. So this is alkalotic. Okay, CO2 normal from 4 to 6. This is 3.5. This is alkalotic or acidotic?
Acidotic.
Acidotic.
Alkalotic يا شباب.
Alkalotic.
CO2 here is acidotic,
Yes.
here is alkalotic. So if I found the 3 parameters here like this, so what is this called? Mixed respiratory metabolic alkalosis. I can find mixed. Yes, I can find mixed. Okay. Clear this point?
Yes.
Yes,
Okay.
clear.
Take another example before we go for the question. I have pH 7.31. I have HCO3 25, and I have CO2 8. What do you expect this condition? What is this? pH here?
Acidic.
Acidotic.
Acidotic. Here?
Normal.
Normal. Here?
Alkali.
Acidotic.
Acidotic.
Acidotic. Acidotic. So what is this problem?
Respiratory acidosis.
Respiratory acidosis. Respiratory acidosis. Okay. Compensated or not compensated?
Not compensated.
Not compensated.
Not compensated. If I found this 28, normal, it will be. So it is will be
Alkalotic.
alkalotic. Okay, and the pH is what? Acidotic. So I have the main problem is acidosis, but I have some compensation here, but still the pH not back to normal.
Partially
So
compensated.
this is partial,
Compensated.
partial compensated. Okay, partial compensation. But if I found this 30, 32, okay, and I found this 36. So pH here is
Normal.
normal, and here is alkalosis, the same. And CO2 here is 8. So the problem is what? Okay, I have 7.36, and I have HCO3 32, alkalosis. And I have CO2 8, acidosis. So I have this parameter is abnormal and this parameter is abnormal.
It's
So how
compensated.
to determine? Okay, compensated what? Is this is the problem?
Fully
Is metabolic
compensated.
alkalosis? Sorry.
It is fully compensated metabolic alkalosis.
Fully compensated metabolic
alkalosis.
alkalosis. Why
Alkalosis.
metabolic alkalosis? Why metabolic alkalosis?
Metabolic.
Why not fully compensated respiratory
acidosis.
acidosis? Why not compensated respiratory acidosis?
Because the pH is towards the maximum,
It is-
the maximal normal, which is towards the metabolic.
Okay, so what you expect the problem here? The problem mainly. Forget now about compensated or not metabolic. The problem here is acidosis or alkalosis mainly.
Acidosis.
Acidosis. No,
Acidosis.
acidosis.
Okay.
Acidosis.
Let's go to this page. Let's go to this page. Okay. Here is 7.35 and 7.45. Okay. I have the pHs here. Yes. The pH is here. So the pH is coming from alkalosis or coming from acidosis?
From acidosis.
It's easier to come from acidosis. Whatever happens in the body, in the compensation, whatever happens on the body from the compensation, the body compensate any problem by getting it back to its normal, just back to its normal and stop. Okay, so if I have a metabolic of alkalotic problem, the acidotic parameter will start to compensate till push this point to go inside this normal range, then stop compensation. Put in your mind that it will stop compensated. It start to push till arrive here in the safe area and then stop. It will never push it till be at the end of the you expect that the metabolic compensation will continue to compensate till it reach to the end of at the edge of acidosis. Completely unlogic. Clear?
Yes, clear.
Again, I have this problem. That what happened? This was here, and then the body started to make metabolic or alkalotic compensation and start to push it here till it bring here to the safe area. In the exam, it will be clear. It will be clear. He will not bring you in the exam 7.4 to make you confused. The exam will give you 7.36, 37, something like this, or he will give you 7.44 or 34, 43. Okay, so he wants you, if you found it in the 14th, if you found it in the 14th, so the problem is mainly alkalotic and the compensatory acidosis pushed it to the safe range. And if you find it in the 13th, 23, 36, 37, something like this. So make sure that it was acidotic problem and the body push it by compensation to the safe area just above the 35, and then compensation will stop because there is no compensation within the normal range. It is in the pH is in the normal range. Why compensation? Why compensation? That's why. Let's go for our example here. 7.636. So this is normal. Okay, but I have in the HCO3 and CO2, both of them abnormal. This is acidosis and this is alkalosis. Go back. This pH is more toward the acidotic or the alkalotic parameter.
Acidotic.
Acidotic problem. So this is the main problem. So this is respiratory acidosis fully compensated by metabolic alkalosis. Fully compensated metabolic acidosis. Okay. I have 7.34 pH and I have HCO3 the same 28 and I have CO2 7. What is this? What is this?
Alkalosis.
Normal. Normal.
Mhm.
pH here is normal. Okay. Agree?
Yes,
Yes.
sir.
Okay. HCO3 here
But
is
alkalosis.
Alkalotic.
alkalotic. Here,
Alkalotic.
Acidotic.
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 So this is mostly compensate as the two parameters are both of them are abnormal. So this is some sort of compensation. So what is the problem here? Let's think. So this is alkalosis. Let's go to the pH and write like this: 7.35, 7.45, and this will be here. And this is the middle, 7.4, and I have my parameter is here. So this is more toward what? Toward alkalosis. So it is alkalotic problem compensated by acidosis. So this is fully, someone here tell me, fully compensated. Someone answer me.
Metabolic alkalosis.
Metabolic alkalosis. Clear?
Yeah.
Okay, let's go for examples together. Let's go for some examples together. Example 1. Okay, someone can read, please.
So you have a pH of 7.22, which is low, so that is acidotic. You've got a PCO2 of 55, which is on the higher side, so that's acidotic, and the bicarb is 25, which is normal. So that's respiratory acidosis.
Okay, so this
like
is
not compensated.
7.35 to 7.45. I have here 55. Forget about this. Forget it will not be in the exam like this. This is almost 7, something like this. Okay, keep it like 7. So here, this pH is?
Sorry, pH acidotic.
Okay. Okay. Let's make a very good table for you. Okay, it will be, and make this table like this. And right here, acidosis. And right here, normal. And right here, alkalosis. Where is the pH? Where is the pH?
Its pH is acidosis.
pH is here, acidosis, yes?
Uh-huh.
Where is the CO2?
It's in the acidosis as well.
Acidosis, okay. Where is the HCO3?
Normal.
Normal. So what is the problem here?
The respiratory acidosis.
Respiratory acidosis. Easy way?
Yeah.
Okay, this is easy. Just write acidosis, normal. If you can't make it with your mind, make this table always. And you'll find the parameter will be written under the pathology. So if it is CO2 is here, so it is the pH is due to acidosis due to CO2. So this is a respiratory condition. If I found HCO3 below this, so this is a metabolic acidosis. And however, I said, okay, if I found both of them here, both of them I found this, what it will be? Mixed.
Mm-hmm.
Okay.
Mm-hmm.
If I found, I make a table, and I found I have here acidosis, I have here normal, I have here alkalosis, and I found the pH is here, and I found CO2 is here, and I found also HCO3 is here. So this is a mixed condition. Yes? mixed acidosis. The same,
Yeah.
if I found the pH is here and both CO2 and HCO3 here, so this is a mixed
Alkalosis.
respiratory and the metabolic alkalosis. Okay. If this is normal, this is acidosis, this is alkalosis. If I found pH is here, okay, and I found CO2 and HCO3 here, this is what?
Uncompensated
This is normal ABG.
normal ABG arterial blood.
All are normal. CO2 normal, HCO3 normal, pH is normal. So this is normal ABG. Clear
Yes,
Yeah.
sir.
Yes, clear.
or confused? I have normal CO2, normal HCO3, and normal pH. This is normal ABG.
Mhm.
Okay. Acidosis, normal, alkalosis. I found pH is here, okay, and CO2 here, and HCO3 is here, okay. This what will be, both are abnormal and pH normal. So this is a compensated condition. صح? Yes?
Yeah.
Compensated
Yes.
condition. How I know the compensated condition? I'll go for the pH, and again, I'll see it is 7.36 or it is 7.44 or something like this. So I know which compensation, which is the pathology and which is a compensation. Okay?
Okay.
Okay, type. Again, I have this one. Acidosis, normal, alkalosis. And I found pH is here, okay? And I found HCO3 here, and I found CO2 here. What is this problem?
Partially compensated metabolic alkalosis.
Perfect. This condition is mainly metabolic alkalosis. If the CO2 is normal, so it is uncompensated. Yes?
Yeah.
But if the CO2 in the acidotic condition on the other side of the equation, so there is some partial compensation, because if it is fully compensated, the pH will move here. Okay?
Yeah.
Clear?
Sir, if carbon dioxide is normal in range, then it is partially
CO2
compensated.
is normal in range, so there is no compensation. There
Sorry,
is no
sir.
compensation. No compensation. You mean
When it is
like this?
no compensation.
When the other parameter is within normal. So this is acidosis. This is normal. This is alkalosis. Okay. And I found the pH is here and HCO3 is here. So what is this condition?
Metabolic alkalosis.
Okay. What is the choices I can have for CO2? I can have CO2 here. Yes. So it will be compensation or no compensation?
No compensation.
No compensation. Type if I found CO2 here, what happened?
There is compensation.
Partial compensation. Why is it partial compensation?
Because the
Because the
pH is
pH.
the pH is still alkalotic. But I can say complete. I can see complete. If the pH is here, I can see complete compensation or fully compensated. Okay. If the pH moved here, instead I don't have this one. Okay, pH moved here, so I have metabolic problem, and the pH moved here, so I have a fully compensated. Whatever fully compensated, which one of them? Okay. Okay. Let's back to this equation as Dr. Sumbal.
Yeah.
Yes. Yes. Dr. Sumbal said this is the problem. She said I have pH low, and then I have the CO2 high, and I have HCO3, so I have a respiratory acidosis. Let's go to the next example. Okay, who can say this?
So there is pH 7.31. Partial pressure of carbon dioxide is 35, and bicarbonate is 20.
What is this? What is this?
pH is acidotic.
Acidotic. HCO3.
HCO3 is also acidotic.
Acidotic. So the problem is, and CO2, it is normal. This is 4. So this problem is? Let's make the table.
Is
okay. Wait. Let's make the table.
metabolic acidosis.
Let's make the table for more easy. Acid, normal, alkalosis. What is the pH?
pH is acidotic.
pH where? Acidotic. What is the CO2?
CO2 is normal.
What is HCO3?
HCO3 is acidotic.
So what is the problem?
Maybe it is not compensated.
I don't know. I forget about compensation now. Compensation will come in another example. This condition is what? The main condition is what?
Metabolic acidosis.
Metabolic acidosis. Metabolic acidosis. Sharp, just keep in your mind. The ABG have three parts. The ABG have 3 parts. It is metabolic or acidotic. يعني metabolic or acidosis. Sorry. 4 parts. Four parts of ABG. The last one, it is acidosis or alkalosis. Okay. Second one, it is metabolic or respiratory. Okay. It is compensated or uncompensated. Okay, and if it is compensated, it is fully or partial compensation. First of all, you have to determine the pH, and then you have to go back to determine it is a problem in the CO2 or HCO3, and then go to the other parameter to know it is normal or abnormal. If it is normal, so uncompensated, but it is abnormal, so there is compensation. Okay. Fully compensated or partial compensation will be depend on the pH. Okay.
Yes,
You'll
sir.
go back to find the pH, it is within the normal range or not, and then you can determine. Okay. So this is the 4 arms of any ABG you have to read. Okay.
Okay, sir.
Okay. So here is, as we said, this is a metabolic acidosis. Metabolic acidosis. Okay. Example 3. Someone else can go with me.
Sir, may I?
Okay, no problem. Just make our table. Okay, this is our table. By the way, I don't like this way, but if you find it easy, do it. I do it in my mind. Okay, here is acid. Here is normal. Here is alkalosis. Okay, pH is?
pH is alkalotic.
pH is alkalotic. So here is pH. Okay, CO2?
Also alkalotic.
Okay, this is almost 3.5. So this is alkalotic CO2. Okay, HCO3?
It is acidotic. It is acidotic.
Normal.
Sorry, sir. Sorry, it's in normal in range.
Why? Normal.
Within normal
So,
range.
HCO3 is here. What do you expect your condition here?
First of all, it is alkalosis.
Okay. Respiratory
Then
or metabolic?
it's a respiratory alkalosis.
Respiratory alkalosis. Okay. Compensated or not compensated?
Compensated. Compensated
Why
as
compensated?
bicarbonate.
This is bicarbonate is normal. So there is no compensation. If I found the bicarb in the other arm, so there is compensation. But if I found it normal, so there is no compensation.
Okay, okay.
So this is respiratory. This is a respiratory.
Alkalosis.
Respiratory alkalosis. Okay. Uncompensated, but he don't want you to know anything about compensation. So this respiratory alkalosis. Clear?
Yes.
Okay.
Sir.
Here is asking you about how to evaluate compensation or not compensation. As we said, if the pH is abnormal, okay, and both of them, CO2 and HCO3 is abnormal, so this is uncompensated. Okay, this is uncompensated. If partially compensated, if the pH, sorry, here either the CO2 or the HCO3, there is one of them is abnormal, causing the pH, and the other one is normal. So it is uncompensated. The other one here, partially compensated, means both of them partially compensated, means both of them are abnormal, and the pH also is abnormal. So this is partially compensated. Fully compensated pH should be normal. When I say fully compensated, so I have to say it pH normal, and both of them are abnormal. So partial or fully compensated, partial or fully compensated, both parameters are abnormal. Okay. Uncompensated means only one parameter is abnormal, only one parameter is abnormal, and the other one is normal. So there is no compensation for the other one. So this is completely uncompensated problem. Uncompensated problem. Let's go for some examples. Who can participate with us? Who can participate?
pH is 7.31.
7.31 pH. Here is acid.
Acidotic.
Here is normal. Here is alkali.
Acidotic.
Okay. pH acidotic. CO2,
And
this is almost 7. This is almost 7.
then it's
Okay.
alkali acidotic.
Acidotic CO2.
And
And
bicarbonate
bicarbonate is,
normal.
this is normal.
20 sorry, as alkalotic.
Alkalotic, so I put HCO3 here. So what is this problem?
First of all, it is acidosis. Respiratory
Respiratory acidosis. Okay.
acidosis.
What about compensation here? Is it uncompensated? If I found the other parameter within normal, so it is uncompensated. Okay. If I found the other parameter is normal, so it is uncompensated. But I found it in the other arm, so it is
Compensated.
compensated. Partial or full, it depends on the pH.
pH and CO2.
Depends on the pH.
pH depends on
If it
pH.
is partial,
So it's
if it is
partially.
partial, the pH will be still acidotic. If it is fully compensated, the pH will back to normal.
pH is normal.
So this, I can see this is respiratory acidosis. I can say because
Sure.
here is the other arm, so I can write here compensation, and I want the other parameter, which is partial or full? Partially compensated. So this is partially compensated respiratory acidosis.
Respiratory acidosis.
Okay. Let's make sure. Clear?
Yes.
Okay. Another example. Who can go? Arterial.
Okay. So the pH.
This is
7 point.
acidosis. This is normal. This is alkalosis. So pH is
Acidosis.
pH is acidosis.
And the carbon dioxide is alkalosis.
Carbon dioxide is alkalosis.
And the bicarbonate is acidosis.
Acidosis. Okay.
So
what
it is
is this problem?
partially
It
compensated.
is okay,
Respite.
partially
Yeah.
compensated
Metabolic
acidosis.
acidosis.
Very good. This condition is acidosis. And HCO3 is mistaken, so it is metabolic. Compensated or not depends. The other arm, CO2 is abnormal, so there is some sort of compensation. And I go back to the pH to know it is fully or partial, so this is partially compensated. Clear? Clear or not clear?
Yes, clear.
Yes, clear.
Okay, let's check the answer. Okay. Another example. Another volunteer.
I don't mind going again. So pH is high.
Okay. pH is?
High, so it's alkalotic.
pH is alkalotic. Okay.
The CO2 is low, so it's acidotic. Sorry, it's alkalotic. What am I saying? Yeah, it's alkalotic. Yeah.
CO2 is alkalotic.
And then bicarb is low, so that is acidotic.
Okay.
So you've got partially compensated, respiratory alkalosis.
Partial compensated, so it is, I say this is alkalosis, and this is respiratory because of the CO2, and there is some sort of compensation here, and it is partial because the pH is still abnormal. So partially compensated respiratory alkalosis. Clear?
Yep.
Okay.
Yes.
One more volunteer, please.
I might try.
Yes, sure. Dr.
Mariam.
Dr. Mariam. Dr. Mariam, تفضلي Dr. Mariam. Wait till we make the table. Okay. Acid, normal, alkali. Start, Dr. Mariam.
Okay, alkalosis, pH.
pH is alkalosis. CO2.
Acidosis.
This is almost 7. Okay. So this is CO2. We have acidosis. And HCO3.
Alkalosis.
Alkalosis.
So it's partially compensated
Okay.
metabolic alkalosis.
What you expect the problem here?
It's already written. Partially compensated. Do you hear me? Can you hear me? Can you hear me now? Hello? Okay. Partially compensated metabolic alkalosis. Did anyone hear me?
Sorry, Dr. Mariam, just disconnected and go back again.
No problem. Just my luck.
No. Okay, sorry again. So sorry again, I'm so sorry for this.
It's okay. Just
We said,
go through our brain.
okay, we said here is acid, normal, alkali, and we said here
The
pH
pH
is
and the HCO3
here,
are alkali.
and
Yeah.
CO2 is
Alkali as well.
here,
HCO3.
and HCO3 is alkalosis.
Yeah.
So the problem will be
Partially compensated metabolic alkalosis.
so this is alkalosis, and this is metabolic, and this is compensated, and this is partial compensated. Partial compensated metabolic alkalosis. Perfect. Who other volunteer? Just want to see what's contacts here. Okay. Who can go? Dr. Amina, Dr. Aya, Dr. Ahmed, Dr. Catherine, Dr. Ibrahim, Dr. Alexander. Who can go
Yes,
for the
sir.
next example?
That's a
Doctor?
Dr. Catherine.
Dr. Catherine. Okay, Dr. Catherine, you can go. Let's draw our table. Okay. So here is acid. Here is a normal. Here is alkali. Okay, go. Here is what is the pH here?
Sorry, sir, my net connection is quite weak.
Okay, take your time. What is the pH here?
pH is normal.
pH is normal. Okay.
And a carbon dioxide is
Almost 8. So this is
acidotic.
acidotic. CO2 is acidotic. Okay.
And bicarbonate is alkalotic.
Bicarb is alkalotic. So what do you expect the problem here? What do you expect the problem here? Mainly acidosis or mainly alkalosis?
Acidosis.
Mainly toward acidosis, yes? Anyone has another opinion? Dr. Sambul?
Hello.
Yeah, what do you expect the problem here?
So
This problem,
is,
what do you expect this problem here? This is
so
normal.
we've got full compensation, and the pH
Okay.
is leaning towards the acidic side.
Well, so, okay,
Um,
we will write here fully compensated. We still have two things.
Yep. So it's fully compensated respiratory acidosis, I think.
Fully compensated respiratory acidosis. Okay, the problem is mainly here acidotic. Which parameter here is going for the acidosis? So the pH is coming from here or pH is coming from here?
It's coming from the acidic.
pH is coming from here, yes? So the problem is mainly what?
Acidosis.
Respiratory acidosis.
Yeah.
Respiratory acidosis. So this is a fully compensated respiratory acidosis. Okay, and this is the picture you find in the COPD. Chronic problem, you find HCO3 sometimes 32, 33. Okay, and the CO2 is high. Let's go to so this is fully compensated respiratory acidosis. Right? I think it's a very nice example. Okay. Okay, Dr. Catherine, it is clear? Dr. Catherine, it is clear?
Yes, sir. It's sorry. I'm in weak network.
Okay.
But I understand, but I understood, sir.
Okay. Would you like to go to some Mrcs examples?
Yeah, of course.
Okay. Let's go to some exam examples. Okay. Who can start with us?
Do you want me to go again?
Yes, sure. No problem.
Okay.
On
So
you, Dr. Catherine, Dr. Aya, Dr. Mariam, Dr. Ahmed, Dr. Alexander, Dr. Ismail. I want you to all to participate, please. Okay. Dr.
Yes, Rami.
Sambar. Dr. Ismail, how are you?
Hello, happy to hear your voice again.
Thank you. How are you? Good?
Tamam, I'm fine, alhamdulillah.
Let's you. I want you to participate with us today.
Okay. I think I have some noise background. Let me check. Okay, can I start?
Well, let's start with Dr. Sambar because she wants to start, and then you go direct after her.
Oh, I really don't mind, but okay. So we've got pH, which is 7.48. That's on the alkalotic side. Our PCO2 is the upper end of normal.
Okay, let's make this.
Yeah, I'll let you do that.
Okay. This is acid, this is normal, this is alkali.
So pH alkalotic, please.
pH is alkalotic.
Yeah. PCO2 is normal. I think.
CO2 is, okay, make it normal.
Yeah. And then bicarb is up, so alkalotic. So what we have here is metabolic alkalosis.
Metabolic alkalosis.
So B.
So your answer is B. Yes?
Mhm. Yeah.
Perfect.
Oh, that's good.
Simple. This is a metabolic alkalosis, okay? Dr. Ismail.
Yes, Dr. Rami, I'm with you.
Oh, okay. So this is the examples, what you can see in the exam. He can give you a table with the parameters and want you to know the problem. Okay. Just to take a few minutes. Sorry, Dr. Ismail, just 2 minutes to understand what is the exam. The exam can give you the table and ask you about the pathology, the ABG abnormality. So it will be metabolic alkalosis. Okay?
Okay.
Clear? Sometimes he don't ask you about the metabolic alkalosis. He tell you the patient has severe diarrhea. So this patient has maybe respiratory. No, this. As example, not this. As an example, the patient has metabolic alkalosis. The patient has severe vomiting. Severe vomiting. So the patient is losing HCl. So the patient has alkalosis. And he don't ask you about the abnormality in ABG. He put in the choices some pathology. So with training, you'll know each pathology what happened. So if severe vomiting, the patient has HCl loss, so the patient has alkalosis, so the patient will have metabolic alkalosis. So from this picture, I know that metabolic alkalosis, okay, and I go for this to search for which condition can cause metabolic alkalosis. Sometimes he tell you the patient has severe vomiting. Sometimes the patient tell you the patient has SHEPS, chronic hypertrophic pyloric stenosis. Okay, chronic hypertrophic pyloric stenosis. Sometimes can tell you the patient has duodenal atresia. So this patient have a metabolic alkalosis. So it can ask you about this problem. This is two sorts of condition, or at least now this is two sorts. Yeah, can ask you about the abnormality or can ask you about the disease that causes this abnormality indirect. The other question that he gave you a scenario with SHEPS. The patient has chronic pyloric hypertrophic stenosis and the patient has severe vomiting. What you expect the ABG to have? And ask you about the parameters of the ABG. Okay. Ask you about the parameters of the ABG.
Yes.
Yeah, that makes sense.
Clear about this? And this one of the some sort of difficult question because you have to read the numbers as fast as you can.
Yes, clear.
Let's go for the other example, which will show us, and I'll give you a very nice way how to solve a question like this. Okay? Yeah. Go, Dr.
Okay.
Ismail. Yes.
Which of the blood gas results listed below is most likely to fit with a patient who has acute respiratory acidosis?
Okay. What you expect in patient have acute respiratory acidosis?
In patients with acute respiratory acidosis, I expect a pH to be low.
This is acid. This is the normal. This is alkalis. Anyone open two?
Yes.
Any has two devices?
Yes, me. I'm using laptop. Let me.
Okay, so I can hear my
I
voice
will
again.
use- Hello, Dr. Rami?
Yes. I can hear both of them. You have to mute one of them.
This is better, I think, right?
Yes, this is better. Yeah. Okay. So what you expect to
Hello?
have in patient has, yes. You can hear me?
Hello?
Yes.
Yes, sorry for this. Yes,
Okay.
pH.
What you can expect in patient has acute respiratory acidosis. What do you expect the pH to be?
Acid.
So you expect the pH to be here. Yeah.
Yes.
Where do you expect the
CO2.
CO2 to be?
CO2 in acid.
You expect the CO2 to be here. Okay.
Yes.
Acid. Where do you expect to find the HCO3?
HCO3 either normal
Yes.
or if partially compensated, high.
Or trying to compensate. Yes.
Alkalosis.
Or trying to compensate. But you remember when we said the metabolic compensation takes from 24 hours to 48 hours to happen.
Yes.
So you will find
If
the
acute,
HCO3
will be normal.
هتلاقيه, you will find it normal.
Yes,
This is very tricky in the exam. He wants you to differentiate between acute and chronic respiratory condition. In acute respiratory condition, the pH, the HCO3 will be normal. So this what you will search in the answers. What you will find also in acute respiratory acidosis. What you will find the O2.
In acute respiratory acidosis, if
Yes, in respiratory acidosis, what you will find the O2. What you
O2
expect for the O2?
elevated.
No, O2 will be low. In any respiratory problem, acidosis, you'll find the O2 low mostly. Acute respiratory acidosis may be due to opioid, due to chest trauma, due to flail. So do you expect the O2 to find it normal? Okay, forget about O2 now. Forget about, let's search about what we expected here in our mind. This picture should be in your mind. I should find pH in acidosis. I should find CO2 in acidosis. I should find HCO3 in acidosis, okay?
Yes.
Okay, let's go to the question in a vertical manner. Show me how you will solve this question.
I will choose choices B, C, and E between these three in pH.
Okay, so I'm going to in a vertical manner. So pH is acidotic. This is acidotic? No. By exclusion, no. This is acidotic? Yes. This is acidotic? Yes. This is no, normal. This is acidotic. So I have, by exclusion now, I have 3. Yes?
Yes.
So I finished HCO's pH. Let's go for the second one, which is
CO2.
CO2. CO2, I have to find it acidotic.
Yes, B.
And the normal is from 4 to 6.
5 to 6 or 4 to 6.
Okay, 4 to 6.
Okay.
Sometimes 4.5, sometimes 4.6, sometimes 4.6 to 6. Okay. Okay, so I have 3 options. I have 3 options now. This one, HP is PCO2 is H 10.2. This is right. Yes.
Yes.
Okay. 7.4.
Yes, elevated.
Yes. 3.8.
No. No.
This is excluded. So till now, I still have two choices. Let's go for the HCO3.
B.
HCO3. Where is the HCO3? Oh, here is the
HB.
HCO3.
Should be normal.
Okay. Okay, and this is the HCO3. I'm searching between both of them. This is
Normal.
normal, and this is
Acidotic.
acidotic, and this is completely not going with the scenario, because bicarb should be at least going to the alkalotic side, and should be at least 27, 28.
If you start
But
compensation.
normal, okay, I should find it normal. Even in acute condition, I found it normal, but this is normal, so this is right. So by exclusion, I found by the vertical manner, I can go with my eyes, A, B, C, E, and right, and then, okay, go for the CO2 by exclusion. So I excluded this one. First, I excluded both of them, then I exclude this one. So I still have two, so I go for HCO3, should be normal. This is normal, okay, this is abnormal, so I excluded this. So this is my answer.
Yes.
Clear?
One
Clear.
question is,
Okay.
sir, Dr. Catherine, how to differentiate between acute and chronic condition?
He will tell you. Acute condition, yani how you know acute respiratory condition and the chronic respiratory condition.
Yes, sir.
Acute condition, something's happened now. Okay, chest trauma, flail chest, pneumothorax, opioid overdose, respiratory depression, head trauma with respiratory depression. This is acute. Chronic, he always tell you the patient has COPD, or the patient has emphysema, or the patient is asthmatic, chronic asthmatic, or the patient has atelectasis, the patient has interstitial pulmonary fibrosis. All these chronic conditions. In all these chronic conditions, HCO3 will be high. Always will be high. You'll find it 30, 32, 33, something like this. In all, but in acute conditions, unless it has one in MRCS, acute condition means the patient is still within few hours. So almost always you'll find HCO3 is normal. Okay.
Yes, sir.
Clear?
Yes, sir.
Okay. 2 minutes break and we'll come back again.
Sir, what
Okay,
is the example of, sir, what is the example of acute condition? Chest, flail chest, then
chest trauma, pneumothorax, flail
pneumonia.
chest, fracture ribs, opioid, head trauma sometimes, patient under general anesthesia, you just start anesthesia and you still need to give oxygen. So you make paralysis, acute paralysis of respiratory muscles. All these conditions are acute conditions.
Okay.
Okay.
Thank you, sir. Thank you, sir. Yes. Thank you.
Okay. I'll pause for. Okay, back again. Who can participate with us? Dr. Catherine.
Yes, sir.
Yeah, you can try.
Yeah, of course.
Okay, yeah. Let's draw our table. Okay, start.
First of all, pH is alkalotic.
pH is?
Alkalotic. Then bicarbonate is normal. Then partial pressure dioxide is alkalotic.
So student, which of the conditions below is most likely to account for the following arterial blood gas? So what is this cause? What is this? What is abnormality here?
Respiratory alkalosis.
Respiratory alkalosis. Respiratory
Alkalosis.
alkalosis. Uncompensated. Okay, let's go for the conditions here. Respiratory alkalosis, yes. Perfect. I think he was going to ask about a syndrome or a condition or a disease, but it's okay. He make it straightforward. Okay, thank you. Another question. Who can go?
Yeah, I can try.
Again, okay. This is our table. Expecting what will happen. Okay, this is acid. This is normal. This is alkali. Okay, read the question.
Which of the following blood gas results would fit with metabolic acidosis with a compensatory respiratory alkalosis?
Okay, let's translate this into numbers. This is metabolic acidosis. So the pH.
Metabolic acidosis.
pH will be where?
Become low. pH become low.
pH
that
will
means
be
acidosis.
here. Wait.
Acidotic.
pH will be here. pH will be here, yes? And acidosis. Yeah?
Yes.
And HCO3 will be?
Sorry?
HCO3 will be where?
Also acidotic.
Okay. Acidotic means the HCO3 will be low, yes? Less than 22.
Yes.
Okay. Compensatory respiratory alkalosis. So what do you expect the CO2 to be?
Compensatory alkalosis, then carbon
CO2 will be here.
dioxide.
Yes. And we will expect it to be low. Less than 4.
Below
Yeah?
4. Below 4, yeah.
Less than 4. Okay, so you expect that HCO3 less than 22 and CO2 less than 4 and pH is acidotic means less than 7.35. Okay,
Below
let's go.
7.35.
Okay, let's make like this as I do in the exam. And make like this. Okay, and this is the pH, this is the CO2, this is the O2, and this is the HCO3. This is the pH. Okay, pH. Yalla, by exclusion. Let's go, sir.
As it is acid metabolic acidosis, so answer between B and answer maybe between B and E.
B is right.
As B, C, B, D, and E.
B,
As
D, E.
pH
So this is completely excluded. Yeah.
excluded. Yeah.
Okay. Then I go for the second one, which is the CO2. I expect to find CO2 what?
Less than 4.
Less than 4. So B can go.
Then it is D, 3.8.
Okay, can go with D. Okay, yani for me, I like if it is a metabolic problem, I go first for the HCO3. HCO3, what I expect HCO3 to be less than 2.2, yes?
Below
22. So
below
this can
22,
be
yeah.
right. This can be right.
B
This
and
can be
D
right. And this can be excluded.
excluded. E is excluded.
Okay. The last one.
Last one is CO2, which is
CO2
below 4.
should be below 4. So this
Below
is
4.
excluded. So this will be right. So my answer will be D. Yes?
D. Yeah.
Yes. Okay. Let's go and check. Maybe we are wrong. Yes, we are right.
Yeah.
Okay. By the way, I don't know the question, and I didn't, since long time I didn't make this lecture, so, but I can solve the question with you now. So it's easy, step by step you can solve the question. Another question, okay, Dr. Who can go? Who wants to try? Dr. Sombar, you can try again.
Yeah, sure. So we have got chronic respiratory acidosis. So with metabolic alkalosis.
So
chronic
this will be, okay, let's just make like this.
Mhm.
Okay, say acid, normal, alkali. So chronic respiratory acidosis with compensatory metabolic alkalosis. This is chronic condition, yeah?
Mm-hmm.
So I can free to add here is fully compensated.
Yeah.
No patient can stay chronic condition. So pH will be
normal.
pH will be normal. Yes. Chronic respiratory condition, pH will be normal. No patient can stay chronically in acidotic or alkalotic state for a long time. So this is pH normal. Respiratory acidosis. So what I expect the pH to be?
pH is normal.
Within normal.
CO2 is going to be acidotic.
HCO3 will be?
It'll be alkalotic, yeah.
HCO3 will be here. And CO2?
It's going to be in the acidotic.
Acidotic. And pH I expect to be 36, 37, something like this, yeah? Yeah, it was a normal. Okay, let's go and start
excluding.
Okay, let's go. Which would you exclude?
So let's exclude B, exclude C, exclude D, exclude E.
Okay,
you got A left.
You are lucky. You are lucky.
Yeah.
Okay. From the first one, you excluded all of them. So your answer is A by exclusion. You did it from the first time. No, I need you to take another one so you can.
That means, sir, please please go back to previous question.
Yeah.
So that means in chronic respiratory acidosis, pH will always normal.
Yes, and you will find it just close to the acidotic condition.
In chronic respiratory acidosis, pH will be normal. Hello?
Yes, I'm with you. Yeah. In chronic
Sir,
condition, this is the picture. This is the picture of chronic condition. In chronic condition, you'll find the pH normal, but you'll find it just close to
Close to acidosis.
7.35, 7.44. You'll find it just close
To acidosis.
to acidosis. Yeah, and I tell you, the body compensation, just push it to the safe area and then leave it. And CO2 will be high. This is a chronic respiratory condition. You will find this CO2 always will be high. O2 will be less than normal by a little bit. Less than normal by a little bit. Bicarb will be always above 30. Mostly, most chronic respiratory condition, you will find the bicarb 30, 31, 32, and so on. Okay. Clear?
Yeah. Yes, sir. Thank you.
Okay. Next question. I need you again.
Okay, so we have a 53-year-old man on ICU. He's had a AAA repair. He develops abdominal pain and diarrhea, and he's profoundly unwell. His abdomen has no features of peritonism. Which of the blood gas pictures is most likely to be present? Okay, so he is abdominal pain and diarrhea. With diarrhea, you lose potassium.
This patient has an emergency. Emergency, it means this is acute condition, yeah?
Acute condition. Yeah.
Acute abdominal aortic aneurysm repair, and this develops abdominal pain and diarrhea. Profoundly unwell. His abdomen has no feature of peritonism. No peritonism. Okay.
It's gonna be.
What you expect? Severe diarrhea. What you lose in diarrhea?
Potassium.
Potassium. You lose HCO3.
Mm-hmm.
Put in your mind, in vomiting, you will lose chloride, you will lose acid, and you will have a metabolic alkalosis. In diarrhea, you will lose bicarb, and you will have metabolic acidosis. Okay. So severe diarrhea, abdominal pain and diarrhea, profoundly unwell, and his abdomen has no feature. Okay, so this patient, I can expect this pH will be acidotic.
Yeah.
pH will be acidotic. Okay, and I expect the bicarb will be
probably acidotic as well.
I expect to be acidotic. And CO2, what do you expect the CO2?
CO2 might be normal.
I told you that respiratory compensation within minutes.
So it could be high.
So it could be normal.
Or it
could be high. Could be normal. Could be high, means could be HCO3. I expect HCO3 to be high, so it's alkalotic. So you expect CO2 to be normal or towards acidosis, toward alkalosis, sorry. It will be low. How high? CO2, you expect CO2 to be low or normal? Yeah?
Yeah.
CO2 to be low or normal. Okay, for me, I expect to be low. Okay, so let's go here. So I'm expected a case of metabolic acidosis. Okay, let's go here. Let's go here. Okay. What is this pH?
So exclude A because its pH is normal.
Okay.
Upper ends of normal. And then we're going to keep, well, yeah, that's normal, lower ends.
Okay.
And then keep the remaining C, D, and E.
Okay, I'll keep positive. Okay, let's go for the CO2. What do you expect?
So CO2 can be normal, so between 4 and 6, or high or low. So anything under 6, really, we can keep. So we can actually keep all 3
So,
of them.
This is normal, and this is normal, and this is abnormal. Okay.
Yep.
Mm-hmm.
But if we were expecting it to be normal or low, wouldn't all 3
Okay,
of
what do you
them
expect
work?
this patient have?
I expect them to be having metabolic acidosis with,
What to expect? This problem has abdominal aortic aneurysm repair. So what complication very common to happen to this patient?
Shock.
Maybe. This patient has no peritonism, so this patient has no bleeding. Okay, just maybe very difficult question because you didn't go for vascular till now and didn't go for abdominal surgery. One of the most common complication of abdominal aortic aneurysm repair is gut ischemia. One is answering. Graft failure. No, a little bit far away. Gut ischemia is very common. In repair of the aorta, sometimes, and you put the graft inside, sometimes blocks or makes thrombosis in the main vessels. Mostly will be superior vena cava, superior mesenteric, inferior mesenteric, or sometimes the artery of Mrcs the artery is going to the spinal cord arteries, sometimes make paralysis, lower limb weakness. Any ischemia to the vessels going to the gut or going to the pelvis, to the bladder, to the genitalia, sometimes makes loss of erection and impotence, sometimes make paralysis of the lower limbs, sometimes makes gut ischemia. Gut ischemia will cause ischemic changes to the gut, will make diarrhea, and will make the lactate so high. This patient, you will find him have high lactate, very high lactate, very high lactic acid from the ischemia. So this is the only one. If you go for the lactate, you'll find the lactate here is very high. And this is one of the complications of the abdominal aortic aneurysm. And as I expected, I told you that respiratory compensation is very high. So this is almost normal. This is the start of normal, but the lactate is very low.
Yeah.
This patient don't have hemorrhage. He told you no feature of hemorrhage, but the patient has got ischemia. So if I have this, I can exclude because CO2 can't be almost normal and high normal also. So I am between C and E. In C, I have the lactate high. In E, the lactate is low. So for me, I'll go for C, and we go to C is the answer.
Sir, what is the significance of lactate in this question?
He want to tell you this is lactic acid. What happens for any organs happen ischemia. If you have limb ischemia, acute thrombosis or acute embolism, for a limp. What you expect? Ischemic limp. Increase lactic acid production due to the anaerobic pathway of respiration and metabolism. The anaerobic will create lactic acid. Any patient with any part ischemic, whatever the body of the ischemic, this ischemic part create high lactic acid. And this lactic acid is very dangerous for the body. Okay, so expect here that lactate is high. Why I know lactate is high? Because the patient has abdominal aortic aneurysm, and one of the complications of abdominal aortic aneurysm, most common complication, that occlusion is one artery to some organ. And I told you I have this as aorta, and I put the graft here, and I have many vessels going to the genitalia. Patient can have impotence. The spinal artery, patient can have lower limb paralysis or lower limb weakness or lower limb numbness. Inferior mesenteric artery, the patient can have ischemia. On inferior mesenteric artery, the patient can have ischemia. What else? All these complications can happen from abdominal aortic aneurysm. In all these ischemic condition, you can find lactic acid is very high. Okay, so this is the importance of lactic acid here, and this is the key for our answer. If it is not this the key, and for me I choose this, it's confirmed by lactic acid high, but it never. Patient has abdominal aortic aneurysm, and you'll find the lactic acids like this. So it's difficult, completely difficult. Okay, yeah, a little bit hard question, but very common in the exam.
Then lactate is the clue in this question.
Yes, lactate and compensation by CO2, but lactate is the most, because this can be right. But if I differentiate between lactate and this, so lactate, it will be feature. By the way, all these questions of ABG are very common in the exam. It's in Mrcs 2020, very common in the exam. This question can come in the exam so easy, no problem. Okay. Who's else? Dr. MP, he's answering in chat, but not sharing with us. I don't know the name. Can you open mic and participate with us? Okay. Okay, who can participate?
Yes.
May I answer?
Also, Dr. Amina.
Yeah.
Okay.
A patient is seen in clinic complaining of abdominal pain.
Wait, make our table. Okay, this is not asking about the table. Okay, no, forget about this question now. This question
Okay.
asking about the anion gap, and we didn't talk about it today. This is, by the way, the anion gap is very conscious. It is sodium plus the positive anions plus the negative anions minus the negative anion. It will give you the anion gap. Sodium, potassium minus bicarb plus chloride. This is anion gap if you want just to know. Just an equation. It will have one question in the exam sometimes, and sometimes you don't have. But you will put sodium and potassium together. Okay, this is a positive, then chloride and bicarb together. This is the negative. This minus this will give you the anion gap. Okay. Yeah, go to this question.
Okay. A 67-year-old male is admitted to the surgical unit with acute abdominal pain. He is found to have a right-sided pneumonia. The nursing staff put him on 15 liters of oxygen via non-rebreathe mask. After 30 minutes, the patient is found morbid, sweaty, agitated, by the nursing staff. An arterial blood gas reveals. Okay, so the pH is 7.15. That's
Okay, let's see. This patient with acute abdominal pain is found to have right-sided pneumonia. The nursing staff put him in 15 liter O2 with non-repressible mask. Okay, this is more for part B. After 30 minutes, the patient is found with morbid sweaty and agitated by nursing staff. The ABG found. Okay, let's go for the ABG. CO2 is?
It is acidotic.
Okay. CO2 is acidotic. O2?
It is low.
Low.
Hypoxemia.
Okay, hypoxia. Bicarb.
Bicarb is alkalotic.
Okay.
And the pH is acidotic.
Base excess. Okay, forgot. pH, what do you expect the pH to be?
It's acidotic, 7.15.
7.15, it's acidotic. Okay, so this patient, what happened?
Respiratory acidosis. It is partially compensated respiratory acidosis.
Okay, I write what you say. Partially compensated respiratory acidosis. Okay. Respiratory acidosis, it is acute or chronic?
It's acute.
Acute or chronic? Acute, because I have the pH is not normal. Okay, what about the CO2?
The CO2 is
What's
low.
about the HCO3? What about the HCO3? 32.
It is high.
What
It's
do you
alkalotic.
expect?
It is
Alkalotic.
chronic.
Do you expect it is chronic condition?
Yeah, chronic condition.
Oh, I got confused now. So I have the HCO3 chronic and I have the pH acute. Okay, so what is this? What is the base here? What is the base here?
The base.
The patient has chronic respiratory problem. The patient has a chronic respiratory problem. It doesn't happen that this patient can have an acute on top of chronic, respiratory problem. Any patient have chronic asthma and can go for status asthmaticus. Never happened, can happen. Patient have COPD and can go for apnea or for morphine overdose, or can go for any cause of respiratory depression. So the key here is that the patient has a respiratory condition, chronic respiratory condition. Okay, by the way, patient having chronic respiratory condition, the main drive for respiration is CO2. Is the main drive for respiration. Again, patient COPD or emphysema or any patient has a chronic respiratory condition, CO2 is the main drive for respiration, not O2. And if you abolish the CO2, the patient can go for respiratory depression. Okay, this question is difficult, by the way. The patient can go on respiratory depression. Okay, so when I give a patient, this is in part B, how to manage a patient with COPD. Okay, how to manage a patient with COPD. Just a minute, please. Okay. How to manage a patient with COPD. Patient with COPD, you have to give him low oxygen, low O2 through what is called Venturi mask. This is controlled mask. O2 with mask and PEEP. Okay. Okay, we give what's called Venturi mask, and this patient just give him from 4 to 6 liters as O2 pressure. I can't give him more than this. Okay, I'm trying to give him, and Venturi mask, maybe I can make Venturi mask up to 28%. I can't give him non-rebreathable mask. This means that he's taking 100%. No, I give him Venturi mask, give him in a rate of 28%. Okay, forget about all of this. Forget about all of this. This is simply patient has chronic COPD, and I give the patient oxygen through a non-replaceable mask and with the highest rate, 15 liter. This patient went into respiratory depression. Okay, let's go for the answers here. It is acute respiratory alkalosis secondary. First of all, this is respiratory acidosis, so this is completely wrong. Yes?
Yes.
Okay, over administration of oxygen on COPD. Okay, and I'm in the exam, I'm confused and I didn't understand this answer. Okay, I didn't understand. Metabolic acidosis, no. Metabolic alkalosis, no.
No.
Acute respiratory acidosis secondary to pneumonia, it will not explain for me the HCO3 32. If this patient has acute respiratory acidosis secondary to pneumonia, and this is right, any patient have pneumonia can have an acute respiratory acidosis, but I found the pH is low, maybe acidotic, 7.33, and I'll find HCO3 normal, because in acute condition, HCO3 has no time to compensate, so I'll find this normal. Okay.
Yeah.
As I found the C, so this is not also. So the only thing I have is here. This is acute on top of COPD. So this is acute respiratory depression due to over administration of oxygen in a patient COPD in a chronic respiratory condition patient. This is the right answer. Clear?
Yes,
Yeah.
clear.
Difficult question? Difficult question. That to put in your mind, once you find 32 in a patient bicarb, in a patient with respiratory condition, put in your mind this patient mostly will be COPD, and search and build your answer on this condition, that the patient has a COPD and then the patient almost have an acute condition. And this, I can remember that this question came in my exam. Okay, so our answer will be B. Clear?
Yeah.
Still confused? Put in your mind, patient with COPD, you can't give him oxygen. You have to give him 4 to 6 liters within a venturi mask in a low rate. This patient, if you give him high concentration oxygen, this patient, you will stop his CO2 respiratory drive, and the patient will go into apnea, and this patient will go into acute condition, and the patient will suffer from acute on top of chronic respiratory condition. Acute, that's why the CO2 is very high, and that's why his pH is very low because of the acute condition. And so we can say that these two can explain for me the acute condition, and this one can explain for me the chronic condition. So this is acute on top of chronic condition. So Rami, what if the options have over oxygenation and B, acute exacerbation of cold? What acute exacerbation of cold? No, it will not
I
have
think he means
this option.
COPD.
Sorry?
I think he means, what if the options were
COPD? Acute
yeah,
exacerbation of
COPD.
COPD? No, it will not have acute exacerbation of COPD. Okay, he will not bring the two answers. You will not find. Okay, MRCS questions are repeated by more than 80%. Never question. Don't rule one in your study. Don't invent or don't imagine new question in your mind. Just study the question in front of your eyes. 80 to 90% of MRCS questions are repeated and present in EMRCS, others in past test. But if you imagine a question in your mind, make sure that it will not come. Okay, there is no time for imagination in MRCS. Okay, there is no time for imagination in MRCS and expect if I have this here and if he write to me here, no. By the way, those who put the exam have temples of questions. They choose from it every year, and they just put about 10, 20 questions new from other temples as well. Okay. So don't imagine any new question, please keep. That's why I'm putting the recalls course only, because I don't know any new question. We'll just go for about 10, 12, 15, 20 exams. We will solve them, plus we will revise some questions from the EMRCS. That's enough for you to pass with a high mark. Okay. Go to another question. Okay, I still have many questions, but I think we can go for 1 or 2 more questions. It's enough for you today. Okay. Who can go for the next question? Very important, this question, by the way.
Go on, I'll do it again.
Yeah, you can. Sure.
Yeah, I really don't mind. It's fine.
Okay. Very important new question as well.
Okay, so if we draw the table, if you want pH, it's low, so it's acidotic. So pH acidotic.
pH is acidotic.
CO2 is high, so it's acidotic.
CO2 is acidotic.
Bicarb is normal.
Okay.
Oxygen,
CO2,
it's important. Yeah, so
O2 is
low.
okay.
So it's hypoxic. So this picture is a respiratory acidosis, but he's
Acute or
hypoxic.
chronic?
So it's acute because the bicarb is less than 30.
Acute respiratory acidosis.
And
Searching your answer.
Yeah.
An acute
there-
respiratory acidosis.
There isn't one. But there is type 1 respiratory failure or type 2 respiratory failure, which we could go for.
What do you expect? So you said acute respiratory acidosis.
Mm-hmm.
I'm searching here. Oh my God, I can't find any acute respiratory acidosis. So what can be?
It's type 1.
Is it respiratory alkalosis?
No.
No. It is metabolic alkalosis.
No.
It is metabolic acidosis.
No.
So it is this or this, yeah?
Yeah.
So what you expect?
So in type 2 rest failure, you would have hypoxia and hypercapnia. The hypercapnia.
Okay, so we
you
have
don't
two parameters abnormal in type 2, and
Yeah.
I only have one parameter in type 1.
Abnormal.
So what do you expect?
So he's got hypoxia because it's 7.5, and he's got a CO2 of 8.1, which is high. So he's hypercapnic. So it's type 2 rest failure. I would have gone for A.
Type 2 respiratory failure. So this is your answer, yeah?
Mm-hmm.
Okay, I just want to tell you a surprise that respiratory acidosis, acute respiratory acidosis equal respiratory failure.
Mm-hmm.
Okay, this is a surprise now, yes?
Okay.
So if you didn't find acute respiratory or respiratory acidosis, sure in the answer you'll find respiratory failure, and both are the same. Respiratory failure equals respiratory acidosis, or to be more accurate, acute respiratory acidosis. Both of them, the picture, but respiratory acidosis, I can make it in two types of respiratory failure, type 1 and type 2. Okay, I can make it type 1 and type 2 respiratory failure. So if I found don't be manic, I just go for, I found one of these. So that's why he gave me the O2 here. So I found the O2 is low because I know it's from 10 to 13. So this is low, so this is hypoxia, hypercapnia. Okay, this is hypoxia, hypercapnia. So this is type 2 respiratory failure. Clear?
Yep.
Yes.
You are lucky with the hard questions. Okay, I want just to reach to a normal question and so we can close. Okay, who else can go? Dr. Catherine, take the last question, please. Hello. Hello. She's not answering. Who can go for the last question? Dr. Amina, Dr. Aya, Dr. Ahmad.
Yes, sir.
Okay, go for the last question, please.
Which of the arterial blood gas analysis shown below would most likely be seen with a patient who has pulmonary embolism?
Okay, pulmonary embolism equal. What happened in pulmonary embolism?
Respiratory acidosis. Acute respiratory acidosis.
Alkalosis because of hyperventilation. The patient with pulmonary embolism shown because of part B. The patient has chest pain and the hyperventilation. From the hyperventilation, the patient is washing CO2.
Oh, yeah.
and the patient going into respiratory alkalosis. Okay.
Okay.
I told you, sometimes give you the problem and want you to know the abnormality, so it will be respiratory alkalosis. And so by practice, you know all of this, by the way. And then I'm going to search here with my vertical manner about which one is respiratory alkalosis here. So yalla go by exclusion.
Okay, by
Respiratory alkalosis.
exclusion,
So what you expect the pH?
we're going to be expecting a high pH. So we'll exclude B and
High
C.
pH. So you will exclude B and C. And we have this. Okay, what you expect? You said respiratory. What do you expect the CO2?
We're going to expect a low CO2.
Low CO2, less than 4.
Less than 4, yeah.
Okay, so we have.
We'll exclude D. And
okay, so CO2 here is 5.8.
yeah,
so
we'll exclude.
excluded. And here is 2.5 and here is 2.8. Oh my God, still I didn't reach anything. Okay, so this is acute respiratory condition due to pulmonary embolism. What do you expect the O2? Still we have O2, and still we have HCO3. Whatever you want to start with. What do you expect the O2?
Low.
Low. Okay. So we have A and D. Here is, what is the O2? Here is 10. And here is 7.2. What do you expect?
Not sure.
Patient with pulmonary embolism, what do you expect is O2? Is O2 to be low? The normal O2 is from 10 to 13. This is here normal.
That's normal.
This is
so
here
it's-
hypoxia. So what do you expect?
So it's the last one.
Okay, so expect this to be wrong, and this is the last one. Okay, I want to be confirmed. HCO3, what do you expect the HCO3 to be in a patient with acute respiratory condition?
It will be normal.
Should be normal because this is acute respiratory condition. It will take about 1 to 2 days to start compensation. So HCO3 here is
It's low. So yeah, that's
low.
wrong.
And here is,
It is normal.
so I'm right 100%.
Yeah.
Clear?
Yes, very.
Okay. Let's see how we get the answer. Okay. I'll give you one more question because you didn't share, and then we stop to this point. Yeah, go for this question.
Okay. Which of the following conditions is most likely to be associated with these arterial blood gas sample? Okay, so the pH is 7.48. That's alkalosis.
So pH is, sorry, this is acidosis. This is acidosis, and this is normal, and this is alkalosis. So pH is?
Alkalosis.
Alkalosis.
And the
And
bicarbonate is also alkalosis.
bicarb is also alkalosis.
And the carbon dioxide is normal.
Carbon dioxide is normal.
And oxygen is also normal.
O2 normal. So this patient ABG results you'll find. Okay, let's go. So this condition, what you expect to have?
Is respiratory, metabolic alkalosis.
Metabolic alkalosis. Uncompensated.
It is uncompensated, yes.
Metabolic alkalosis uncompensated. And this is rarely to happen, by the way. Okay, so Here is respiratory alkalosis.
No,
Okay, metabolic acidosis.
no.
Okay,
Yes.
metabolic alkalosis. Right, we have to continue. Metabolic acidosis again.
No.
No,
And
metabolic type 2 respiratory. So my answer is metabolic alkalosis. Clear?
Yes.
Do you want more or it's enough for today?
I think it's enough.
I think it's enough. Yeah, we have more than 3 hours.
Yeah. Thank you very
Yes.
much, Doctor.
Okay. Thank you all. I hope I could help you today. How to read ABG. I still maybe have 3 or 4 more questions. The same as we said and the same idea. How to, like here, seen in a patient with a high output ureterosegmoidostomy, this patient is losing
Metabolic acidosis.
this patient has metabolic acidosis from the ureterosegmoidostomy. Sometimes I tell you the patient with mesenteric infarction, the same example we answered mesenteric infarction, so the patient will have high lactic acid, this patient will have a metabolic acidosis. So expect this patient to have acidosis and HCO3 is high, so this patient has widespread mesenteric infarction. This patient has metabolic acidosis with compensation, respiratory compensation. Okay. And again, this question is repeated. Okay. Thank you for today. Thank you, Dr. MP. Thank you, Dr. Ahmed. Let's pause, stop recording.